Dear students, this video will be useful for you to learn about uterine abnormalities and displacement. I am Ruth Kezia, Assistant Professor in Tripoli College of Nursing. The objectives: we're going to see about the uterine abnormalities, the introduction of the uterine abnormalities, definition, types, causes, in impact, diagnosis, and management. And then we are going to see about the uterine displacement, the common displacement of the uterus and its management. First, we are going to see about the uterine abnormalities, the first topic. The uterine anomalies are quite often asymptomatic and are hard to recognize. Women with a history of miscarriage and preterm deliveries have a higher incidence of uterine anomalies. And for pregnancy and labor to be achieved at a minimum difficulty, a woman must have a normal reproductive anatomy. When there is a structural abnormalities of pelvic organ, there can be extra burden for the mother and fetus. Uterine abnormalities always have an obvious symptoms like severe bleeding, pain and abnormal bleeding. But the fact is many women with uterine abnormalities have no symptoms at all and may not be aware of their condition until they face any issues like fertility issues or the menstrual problems or recurrent miscarriage, preterm delivery and so on. So uterine anomalies can be asymptomatic as well as symptomatic. We'll go on to the definition. What is the definition of uterine anomalies? Variations in the uterus shape or structure often caused by faulty embryological development of the Mullerian ducts is called as uterine anomalies. So which is the organ that is responsible for the development of the uterus is the Mullerian duct. Mullerian duct seems to unite together, the two ducts seems to unite together during the embryology. So this process of unification, okay, that is very important in the formation of the cavity of the uterus. So any variations in the fusion of this embryological development causes faulty in the structure and shape, that is called as uterine anomalies. So causes an impact, causes is embryological maldevelopment of paramesonephric Mullerian ducts. Impact, it can lead to infertility, recurrent miscarriage, premature birth and other pregnancy complications. So we'll see about the embryogenesis. We keep telling that it is formed by the faulty development of the Mullerian duct. So what exactly happens there? How uterine abnormalities form Mullerian duct development. During early gestation, that is as early as 7th to 8th week, two tube-like structure called the Mullerian ducts are responsible for formation of the uterus, cervix and upper vagina. So what happens? Next comes the fusion and septal absorption. So when this uterus, cervix and upper vagina is being formed by the Mullerian ducts, these ducts typically fuse together to form a single uterus and then undergo a septal absorption to create a single cavity. This is a normal physiological development of the Mullerian ducts that is represented here in the picture as formation, fusion, resorption of the septum. So all the pictures here shows the normal development of the uterus. That is the embryogenesis. That is exactly happens in the Mullerian duct. Okay. So how the faulty development occurs? So it can be because of incomplete fusion or incomplete septal absorption or unilateral development. So what is incomplete fusion? Two Mullerian ducts may fail to fuse properly, resulting in a double uterus or a partially divided uterus. As you see in the picture A, that is uterus diadelphus with the double vagina. And second is incomplete septal absorption. If the central septum wall between the fused ducts is not completely absorbed, it leaves a partition within the uterus, as you see in the picture B, that is uterus bicornis. The cavity is divided into two, that is the septum is not absorbed completely. The third one is the unilateral development, that is, in other cases, one Mullerian duct may fail to develop entirely or partially, leading to one-sided uterus, as you see in the picture C, that is uterus bicornis, unicornis, that is only one, with a rudimentary horn. Okay, so this is a faulty development, which can occur during the Mullerian fusion. What are the types of uterine abnormalities? Based on the complete and incomplete, based on the resorption of the septum and the fusion of the duct and the formation of the horns of the uterus. Okay, it is divided as um, complete, as you see in the picture, complete agenesis, unicornuate with horn, uterus didelphus, complete bicornuate, partial bicornuate, and complete septate. Based on the resorption, it is complete septum, partial septum, and arcuate. So if you see here, we have written like congenital here. All the things here is caused by congenital, that is uterus didelphus, bicornuate uterus, arcuate uterus, septate uterus, unicornuate uterus, and acquired. Uterus didelphus is double uterus with double vagina. Bicornuate uterus is heart-shaped uterus. Arcuate uterus is dent in the top, and septate uterus is a wall or a partition inside. Unicornuate uterus is one-sided uterus acquired. So this uterine abnormalities can also be acquired, may not be because of congenital reasons. The reasons can also be uterine anomalies resulting from infection, scarring, or trauma. So the type basically is divided into congenital and acquired. Congenital is again divided as you see in the picture, based on the formation, fusion, and resorption. So we'll move on to the diagnosis. How is we are going to diagnose a woman is having a abnormal uterine development? That is based on the imaging sounds. Okay, imaging tests like ultrasound and hysteroscopy, magnetic MRI, magnetic resonance imaging, saline infusion, sonohysterography. So the last one is shown in the picture here, that is sonohysterography. So they basically inject a dye into the cervix, that is HSG, means hysterosalpingogram. Okay, basically it's inject a dye into the cervix, and seeing how where the dye travels, okay, through the imaging, radio imaging. So that shows you the exact margins of the inside of the uterus. Okay, if there is any septum, you can see it clearly. Okay, so that is what given in the picture, that uterine cavity is divided into two cornua. This is usually does not require surgical correction. It appears similar to a septum on HSD, that is hysterosalpingogram. MRI, ultrasound or laparoscopy is the best technique for its diagnosis. Okay, this is how the uterine abnormalities are diagnosed. Management. What are the factors guiding management? So as I said earlier in the introduction, some women may exhibit symptoms, some may not exhibit symptom, and they can have a successful pregnancy, and they can be left undiagnosed even. Okay, so it depends on the severity and the type of the malformation. What are the problems the woman is facing? Depends on that only the management is decided. Severity and type of malformation. The specific anatomical abnormality dictates the treatment approach. Reproductive history. History of infertility or recurrent pregnancy loss often prompts consideration for surgical correction, particularly for a septate uterus. So if a woman gives you the history of infertility or recurrent pregnancy loss, then we go for a surgical correction. Otherwise the surgical procedure is not indicated. Okay, so these are the factors that guide the treatment: severity and type of malformation and reproductive history. So this is a surgical treatment, that is hysteroscopic septum resection and laparoscopic surgery. In hysteroscopic septum resection is recommended for septate uterus, where a wall, that is septum, divides the uterus. Surgery removes the septum, significantly improving the chances of a successful pregnancy. So as you know, for a pregnancy, the fertilization happens in the your fallopian tube, and the embryo will travel and get implanted into the uterus decidua, right, the inner innermost layer, the endometrium. It gets implanted into it. If the endometrium has some septum and some, if the surface is not regular or not smooth because of the septum, the embryo will not get implanted. Even if it gets implanted also, the growth of the fetus can be restricted because of this septum. So we need a surgical correction. So one of the surgical correction is the hysteroscopic septum resection. So that can lead to a successful pregnancy. The next is laparoscopic surgery. In some cases, surgery may be performed to correct other abnormalities like removing a rudimentary uterine horn in a unicornuate uterus that can cause pain or obstruction. So these are some of the surgical treatment indicated in case of uterine abnormalities. When surgery may not be indicated, what are the cases where we don't need a surgery is that uterus diadelphys. Surgery is generally not recommended for a diadelphic uterus as many women with these anomalies have successful pregnancies. And bicornuate and unicornuate uterus, while these can increase the risk of miscarriage or premature birth, surgical treatment is rarely needed unless there is a specific obstructing feature according to fertility clinic, according to Cloud9 and Nova IVF fertility clinic. So what they say is the unicornuate and bicornuate uterus, they can also have a successful pregnancy without any surgical correction, just like uterus diadelphys, unless there is a specific obstructing features. Okay, sometimes the mother or the fetus can experience miscarriage and premature birth because of the space, small space available there. Okay, but most of them has successful pregnancy here also. The other considerations are hormonal or medical management. Some conditions such as accessory cavitated uterine malformations may be treated with medications like oral contraceptives, though surgical correction is often more effective for long-term relief. Okay, hormone treatment also helps in treating this condition, that is uterine malformations. And fertility treatment, that is in some cases of infertility related to uterine malformations procedure like IVF may be an option either alone or in conjunction with a surgery. Okay, so IVF is also recommended as one of this other treatment. And no symptoms, that is many women with uterine malformations have no symptoms and may not require any treatment at all. Next we'll see about the uterine displacement. So till now we saw about the uterine abnormalities, the introduction, the definition, okay, the causes and impact, the types of uterine abnormalities, how to diagnose it, and what are the treatment options available, how the treatment is guided, on what basis, okay, and what are the treatment options available for it. Next we'll see about the uterine displacement. Okay, as the name implies, the uterus is there, the structure of the uterus is same, okay, the anatomy is good, but the space, the position is different here. Okay, the normal position of the uterus is anteversion and anteflexion. Okay, definition: abnormal positioning or angulation of the uterus is called uterine displacement. What are the common displacement? Excessively anteflexed, uterus bent too forward, retroflexed and retroverted, uterus bent backward and tilted backward, and anteflexed and retroverted, that is uterus bent forward and tilted backward. So as you see in the picture, first is retroversion. Okay, so the normal version is given as a dotted line. The uterus is supposed to be in the position like a dotted line, but you see the picture there, uterus is tilted backwards. Okay, it is flexed backwards. And the second one, if you see in the retroflexion, here also the normal position is given in the dotted line, but the uterus is there, the position is retroflexion. The third picture we see is the anteflexion, that is too much anteflexed, excessively anteflexed. Even here also we see the dotted line as a normal position, but you see the uterus is too much bent forward. Okay, these are some of the types of uterine displacement. What are the management here? Medication and hormonal therapy first is used for acquired abnormalities caused by infections or scar tissue, and surgery may be recommended to correct congenital abnormalities or other complications that don't respond to medication. Then we have this ART, that is assisted reproductive technologies, can be successful in helping women with uterine malformations achieve pregnancy. Multidisciplinary approach where reproductive endocrinologists and infertility specialists play a key role in managing these patients. So these are the treatment options available for uterine displacement. So I hope you gained some knowledge regarding the uterine abnormalities and uterine displacement. Thank you.